Right. There were very exciting presentations during the World Lung Conference this year in Singapore, which I attended personally. And one of the biggest updates in the field was the FLAURA2 clinical trial, where the osimertinib was combined with a platinum-based chemotherapy and showed about close to 9 months difference in terms of PFS. There's a lot of other unanswered questions, whether the improved PFS may translate into overall survival. I think that's one of the key questions we need to understand when we have more mature data from the trial. But it's a study that we've been waiting for a long time, and the field has been waiting for the results. And now we have to understand the data, digest the data, and how that may be applicable to the day-to-day clinical practice. But it was nice to see some combination approach being tested, and now we have the results. And so it could be an option going forward. Personally, I don't think that's for everybody, but there may be some high-risk patients, such as those with the brain metastasis. In the FLAURA2 study, there was benefit in terms of using the combination in those subset. It can be a surrogate. Having brain metastasis can be a surrogate for higher burden disease, higher risk disease, but it was one of the interesting subgroup analysis that we saw in FLAURA2. So we'll see how that affect our clinical practice, and then whether that will lead to approval by the FDA down the road. Many questions at this point, but it's nice to see significant PFS benefit with the use of chemotherapy and then osimertinib front line. And then some other exciting data. We have seen various novel TKIs. For instance, we have seen data on furmonertinib, which is the EGFR exon20-targeting TKI, where they showed in the first-line setting very high response rate of, think about 70%, and then in second line, around 42% or so. And so this is a tough population. We have 2 drugs now approved by FDA, amivantamab and mobocertinib, but there's an unmet need to develop more effective therapies. And some of these novel EGFR exon 20 targeting TKIs may be utilized in the clinical practice and improve patient outcomes. So I was excited about the results. And we have seen other trials where they used the ADCs, antibody-drug conjugates, and showed efficacy in the tough to treat population in later line setting and also the frontline setting. And so those are some of the, I think, highlights of the conference.